Hi everybody, welcome to this UroChannel video about frequent urination at night, also called nocturia. I will explain to you the different reasons why this might be happening. But as always, life's not easy and there are no one-size-fits-all answers to this problem, as many conditions may be involved. A video is not a medical consultation. If you experience any health issues, please visit your local doctor. Having to get up at night a few times really can take the fun out of life. If you're lucky, you'll be able to get right back to sleep. But many can't and are bothered a lot by the repeated urge to urinate at night. It affects also daytime activities as you are tired because you don't sleep well. As a rule, nocturia develops with age. When you reach the age of 60, most people have to go once every night. That's pretty much unavoidable. And it not only affects men but also women. But having to go a few times is another story. One of the most important diagnostic tools is this, a bladder diary. Over a period of 3 days and 3 nights, you write down when you drink, how much you drink, when you have to go, and how much urine is voided. You will need a measuring cup for this. What this list tells me as a doctor is this. Is this an isolated nighttime problem, or is there also frequent urination during the day? How often does my patient have to go at night and during the day? How much urine is passed each time? Is it normal volumes or are they diminished? Are volumes normal during the day and diminished at night? How much is the fluid intake? Is there an increased fluid intake at bedtime? Sometimes just looking at the bladder diary reveals the problem. There is a simple correlation. If you drink a lot, you will have to pee a lot, especially before you go to bed. Nowadays, people almost get brainwashed with information to drink loads of water. Yes, it is important to drink regularly and to adapt the fluid intake to environmental conditions and physical activity. But it is not necessary to always carry a bottle of water with you and to drink at all times, because the body will have to eliminate all that fluid, meaning that it urges you to go to the bathroom. Young people have good kidney function, so they get away with overly fluid intake. But when kidney function for whatever reason is reduced, elimination of excess water will be a burden to the cardiovascular system. Another thing is cardiac insufficiency that many people suffer from after a certain age. The heart is simply not strong enough in this condition, which results in less blood flow through the kidneys. The excessive fluid is then following gravity. The consequence is what we call edema. It is a swelling around the ankles and legs that resolves somewhat at night because in a horizontal position, the heart will be able to pump more efficiently. This means more blood flow through the kidneys and elimination of excessive fluid. Since this is happening at night, unless you sleep during the day, the result will be frequent urination at night. In the bladder diary, this will show up as normal volumes. So I think you start to get the picture. As a doctor, I try to dissect the problem and eliminate possibilities one by one to come to a diagnosis. At first, I try to figure out, am I dealing with a health condition or is it just too much fluid intake? This is what the bladder diary is for, among others. By the way, if you drink a lot because you are thirsty, this is another story, as it might be a sign of diabetes, and diabetes is a reason for nocturia and overactive bladder. When fluid intake is out of the picture, then the question arises, is this a problem of the urinary tract or a symptom of a condition that strictly speaking belongs to another specialty? Even here, the bladder diary is of assistance. Common conditions outside urology which cause nocturia are the already mentioned cardiac insufficiency and diabetes, and sleep apnea. Obesity is a common problem in Western societies, and being a man, being over 50 and being obese means high risk for sleep apnea. Mostly it is the obstructive type, which means that the pharyngeal muscles collapse during sleep. Then you can't breathe. Some stop breathing for over a minute. But they're still trying. What this does is disturbing the blood flow of the body, eventually resulting in more urine production at night. There are other diseases that also might cause nocturia. As a normal part of aging, ADH levels may decrease with time. ADH is the antidiuretic hormone. It regulates body hydration and is released from the pituitary gland in the brain. Nature has implemented a diurnal rhythm so that ADH increases when we sleep and less urine is produced, so that we get our needed rest. When we get older, this rhythm gets weaker, resulting in nocturia for some people. When it comes to core urology, there may be several reasons for nighttime urination. Once again, the bladder diary will help to break down the problem, especially for figuring out whether this is an isolated nighttime problem and in terms of voiding volumes, because it makes a difference whether voided volumes are normal or decreased. Very often in nocturia, people void only 50 milliliters each time despite sleep-disturbing urgency. Questions I then will have to answer are, is the bladder emptying properly, or is there any residual urine, especially at night? An enlarged prostate might inhibit bladder draining abilities, especially at night. Weak stream and low voided volumes give a hint here. You might be familiar with this. At night there's a very weak stream, but during the day it's quite okay. My patients tell me this all the time and it bothers them a lot. Other things I routinely have to eliminate from my list are urinary tract infections. I will always be conscious that I might be dealing with a bladder cancer or prostate cancer here. Maybe stone disease with bladder stones or kidney stones. Sometimes it might also be an overactive bladder. There are examination techniques to find out, but it all starts with a thorough history and a bladder diary. What can be done about it? Generally, treat the underlying disease. I will upload videos about specific treatments in the years to come, but for now, it's bye-bye. Don't forget to subscribe and thanks for watching.